Hi, Tina Ketchy Stearns here, and this week I want to talk to the doctors. I educated a doctor recently, and her father had just gone through a pretty big scare. He had a heart blockage of about 80% in one of his valves. And I just want to remind the doctors that I educate that you are people first. And yes, this information, being able to communicate more comfortably and without fear with your patients and families about end-of-life care, those tough conversations you have to have often, that this information is also for you from a personal perspective, because everybody looks to you to help them feel better and fix what ails them and help them through really tough times. And sometimes you can and sometimes you can't. And when you can't, you know, it's just the circle of life, and that just is what it is. But oftentimes, having a better understanding of what hospice is and what it isn't and all the ins and outs of that, it's really to benefit you personally. So this one particular doctor that I educated, she was very grateful, and she felt like she could really much better support her patients and families with that information, but also was helpful to her personally. So this is just to kind of reach out to the doctors and the different providers out there and say, you know, you're doctors and you're what everybody looks up to many, many times, but you're people first. And you need this from a personal perspective as well. So whether you're a provider, whether you're a caregiver, whether you're just a family or friend, everybody needs to have a much better understanding of what the end of life conversation should be and what maybe it shouldn't be. And so I just encourage everybody, you can always reach out to me at tina@it'sabouthowyoulive.com. My website is the tagline to the hospice ribbon. But especially, again, this week for the providers out there, you need this information from a professional perspective, but also from a personal perspective. So please get in touch and let me know if there's something I can do to help you feel a little more comfortable having these conversations and allowing you to take better care of your patients and families as well as your own loved ones. All right, you guys have a great week, and I'll see you next week.